Welcome. I'm Jeannie Rosner. I think I've met everybody that's here. Maybe there's a random person that I haven't met, but I know there's some newbies here today. So can you raise your hand if this is your first salon? Wow, awesome. So each year I affiliate with an entity, and this year I'm affiliated with Food Corps. So there's a couple flyers out front. So basically Food Corps, they started about 7 years ago. They're in about 18 states, 365 at-need schools. And essentially what they do is they put AmeriCorps service members in these at-need schools, and they teach the students there all about fruits and vegetables and healthy eating and healthy living. And they have a school garden. They get in the garden with the kids. And so each year I affiliate with someone. That's who I'm affiliated with. And the goal is to raise $10,000. And I'm asking you all to help me to raise that money. So far we've raised $9,200. So we just have 800 left to raise. And we can go beyond the 10,000. I think they'll be happy if we raise more than that. But you can either go online onto my website, soulfoodsalon.com, the main page in the middle, there's like a little link that you can click on to make a donation, or you can actually fill out these little forms today and I can take them and hand them into them. So please help me to raise that if you don't mind. So today I have the pleasure of introducing my dear friend Julie Kornfeld. So Julie and I met 30 years ago now in Miami. I was finishing up my residency. Julie was working at the medical center. And so Julie got a master's in public health at University of Miami Medical School and a PhD in epidemiology. And she went on, she's just amazing, she went on to be the assistant dean of public health at the University of Miami School of Medicine, where she launched the nation's largest integrated 4-year dual degree in medicine and public health. And she's just passionate about teaching and learning. And her work as the medical master's student, she earned the University of Miami's Outstanding MPH Faculty Member Award for teaching and mentoring students in 2014. So then a few years ago, she got recruited to the School of Public Health at Columbia in New York. So she left Miami, went to New York, and her whole family followed. And she's currently the Vice Dean for Education and Associate Professor of Epidemiology at that school. So we've grown a lot together. We learn together, we teach, we hopefully empower and inspire each other. And that's what she's going to do today for us.
We didn't give Jonathan any credit, but Jonathan and I also grew up together, so Jonathan's Jeannie's husband. 50 years, right. I was in utero when we met, but I was blowing the cover a little there, Jonathan. Okay, so I'm thrilled to be here. Jeannie's been asking me to come for a long time, and I'm excited to be here and talk to you a little bit about what I'm passionate about, which is public health and science. I am the Vice Dean of Education at the Mailman School of Public Health at Columbia, and I typically, I usually talk to much different audiences. I teach, as Jeannie mentioned. These are the kinds of topics that my students study, and my main goal in life, or my job during the day, is really both to set the direction of the educational programs at the Mailman School of Public Health, but also to teach our students. And we have students that come in, you can imagine, in public health who are incredibly passionate about changing the world. And what we really try and work with them is to give them the skills and the knowledge and the scientific base to go forth and actually apply that knowledge and translate that into action. And they do that through their master's degrees and through their PhD programs. So you'll forgive me, I'm used to talking to students often. I also do talk to my own faculty, and you can imagine also there. So I'm fortunate to be surrounded by brilliant researchers. We have over 400 faculty members at the School of Public Health alone, doing all kinds of things in research and climate change and incarceration issues and social justice issue and cancer prevention and pretty much any topic you can think of. And their work is primarily to use their scientific training to generate new knowledge and then hopefully translate that knowledge into action. Most of the time they publish in journals and scientific journals, and many of us don't read those scientific journals. They're pleased when they can get their science into headlines, but it often isn't exactly as it was written or as it was designed, and they struggle with that. So we talk a lot to our students about how do we want to teach you science, but we want you to be able to translate that science in ways that that can be actionable. And we also train our faculty to do that, because actually they were trained to be scientists, not actually communicators. And so there's a little bit of really trying to do what we are generating, which is the translation of new knowledge into practice. So that's kind of how I spend my time. It gives you a little bit of an idea. And what I was hoping to do a little bit today, from my perspective, is to talk a little bit about why does public health and science matter. Jeannie and I talk about this a lot. We all read headlines. People get confused. I'm sure you say it, or you have people say to you, I don't even know what to do anymore because I read this and I read that. And some of that's deliberately designed by people who are trying to confuse you into inaction. And some of that is just overwhelmingness of what we hear. So hopefully we'll talk a little bit about that and break that down. And I want to talk a little bit, because this is important to me, is what happens what are the consequences of when we act on misinformation, or misinformation takes over. And how does that impact our health, both individually and as a global community. And then I'll talk a little bit about global trends and things that we see coming, and the kinds of things we're focusing on a bit at Mailman, as ways to think about how we can make our own decisions for ourselves and be empowered to help improve the world. So that's my agenda. Let's see how it goes. Okay, so I'm going to talk a little bit about why does public health and science matter. So I'm showing you this because I think these are all of the things that influence health. We tend often to focus on these two things, but in actuality they contribute arguably 20 to 30% of our health is linked to our genes or to our access to medical care or health care. Most of what influences our health and impacts our health are these other aspects that are external to us. There's a tremendous amount of science. You've heard the term maybe exposomics, epigenetics, microbiomics, metabolomics. I'm not going to talk about any of that today because that's not what I do. But only that is to say that there is tremendously exciting science going on at a basic cellular level that looks at how all of these things come together and influence our health. But what I really want to focus on today is how all of these things that we know about, the knowledge that we already have, and how that can be translated into public health for our communities, for our world, and for each other. I'm going to talk a little bit about what I know best, and that's public health. So in the last 100 years, we've had incredible achievements in public health. Most of you know this, right? So life expectancy has improved dramatically from about 45 to 50 at the turn of the century to 80 to 100 now. And really, just to talk about some of these, and I'm just going to go through these fairly quickly, but again, I want to say these things because I believe it reminds us that we have achieved a lot in science, we know a lot, and it has changed the world that we live in. And we need to act on that change and continue to act on that change. So some of these things you're going to be familiar with, and I'm going to talk about vaccinations a bit today. Not necessarily to generate controversy, but to just make the point that there's some things we know irrefutably. And so, what I want to show you is just this, right? So there's a lot out there, and we're going to talk a little bit more about this. But you can see that this around the turn of the century were the number of deaths. Even though numbers aren't important, this is what happened in 2001. And these are the percent decreases in these specific diseases because of vaccination. So this is public health numbers that we don't see in most things that we do, right? We change our diet, we don't see a 99 or 100% increase or decrease in an incidence of heart disease or diabetes, et cetera, right? So really important, these are really advances, successes that we've been really proud of. And as a result of that, in the last 100 years, we saw infectious disease go dramatically down. These are examples, I could go through many of them. This is another one. We saw measles cases go dramatically down. We'll come back to this in a minute. Okay, but this is what it looked like over the last 100 years, right? We were in a steady state of no cases, okay? The other thing to highlight, there's a lot of things that we learned in public health, though this is something that we don't often talk about, but this is actually the decreases in death associated with motor vehicle accidents. So at one point in time, 50 years ago, 60 years ago, motor vehicle deaths was the #1 cause of unintentional injury in this country. It no longer is. It's a huge public success story. It was the result of investments in infrastructure, roads, cars, in individual behaviors, getting people to wear seatbelts, policy change in terms of drunk driving laws, and advocacy. So those things are very powerful, and I stress it here because it's things that we can think about. This was a model for public health success. What's the #1 cause of unintentional injury death now? Guns. So I could show you another chart, I'm not going to, but what's happening in this country is motor vehicle deaths are going like this, and gun violence is going like this, and the two are actually flipped. So I raise that again. I'm not going to talk to you about gun violence today. That's a whole nother talk. But some of the changes, there was a time when people fought changes in infrastructure for government. People fought wearing seatbelts because they felt it was their individual right to choose what they did in their car, right? People fought legislation because for alcohol. It happened state by state, and then eventually it changed. So I say that all to kind of empower us to remember that we've done this before around injury. We could do it again. Okay? The other place where we've done it is in tobacco. And so you can see we had a dramatic increase in tobacco consumption. This is a story you all know well. We've been incredibly successful in public health. Again, a public health success story because it happened at multiple levels, right? We changed. The number one reason why teenagers stop smoking? Who knows? Guess.
Legislation.
Right, because?
You can't buy it. You can't
Can't buy it, and what else happened?
It's expensive.
It got expensive. Exactly right. So one of the reasons why we hit teenagers exactly where it mattered, which was cigarettes cost money, and as they taxed them and they became more expensive, teens stopped drinking. I'm going to go to McDonald's or I'm going to buy cigarettes. Right, that's another problem. We'll talk a bit. We'll talk about that too. But the point being is that there are levers that, right, the big tobacco is, the big food is the new big tobacco, and we'll come back to that, okay? So there was huge fights around tobacco. Most of us remember them, right? And we also got to a place where we got to make legislation around secondhand smoke because we were going beyond just changing individual behaviors, where we were terribly unsuccessful. In public health, we tend to be unsuccessful when we try to change behavior one person at a time. Because all of us know that why, right? When you tell somebody in your life they should stop smoking, drink less, eat better, more healthy, it's incredibly difficult. But when we change the context so that communities, and it's easier to make a healthy decision, so if it's illegal to not wear your seatbelt or you get in your car and it starts dinging like mad, you put your seatbelt on and you move on and you are now in a safer situation. Right? If we fluoridate the water, you don't have to think about taking fluoride supplements. Your teeth, we don't have cavities the way we used to have them. So when we're successful, we do things on multiple levels. And again, I think it's important because we're going to talk about food later, and big food is fighting a very similar battle with us and using very similar tactics to big tobacco. And they have a playbook to follow, but it doesn't mean that we can't be successful because we have been in the past. Okay, so what I want to switch gears a little bit, and is to talk about, so what happens what are the consequences of misinformation, right? So what happens when we start to doubt accepted facts and concepts? And you know, we often hear, all of us hear the term fake news. Most of the time we think about it in the terms of politics and what's happening in the world. But I want you to think about it also in terms of food. There's a lot of, and our health, right? There's a lot of information that's generated and spread that affects our ability to make clear decisions about health for ourselves and for our communities. And it makes us question what we're doing, and there are costs and consequences to that. So I'll talk a little bit about vaccinations, again, because I want you to understand that each of us are in positions every day to counteract these arguments, to make sure that we're making decisions and sharing information based on science and based on fact, because there are very powerful forces, and social media escalates those forces so quickly, and it's really difficult to refute. And what we're seeing, and this is such an easy example to show you, I mean, these are just slogans and things that you pick up on social media all the time. My students bringing me examples of this all the time. But what's happening as a result of that is, so I showed you this. So this is measles, and then this is showing you around 1963 when we had the first measles vaccine. This was the inactivated one. This is the live vaccine. This is MMR. And then you can see, so it's basically just showing you when the vaccines came into practice and common use, and then what happened in the measles epidemic. Okay, so this is the success that we had that I showed you a few minutes ago, and this is where we are now. Okay, so this is the worst start to the year for measles in a quarter of a century. Actually, Marin County in Northern California has some of the highest rates of unvaccinated children in the country. This is the headlines where I live in New York City today. So there's a huge outbreak going on in New York City among Orthodox Jewish community. We have, I think, 265 cases of measles in the city right now, with a huge holiday about to come up where families come together. Measles is incredibly contagious. incredibly contagious. So if I had the virus and I sneezed and walked out of the room, all of you would be exposed, and so would the people who came to the next presentation. It's incredibly contagious. Okay, so this is a real problem. And I say all of this because this is the result of the misinformation that's been spreading for a long time. So it's not harmless when we see these things and we hear these things, and they're not science-based, and we need to refute them because it's really important. And what's happening in New York City is that the mayor, the commissioner of health, who happens to be on our faculty, this is what they're spending their time for the last 3 months. So people who have diabetes and mental health issues and gun violence outbreaks and all the other important programs that were happening in New York City, put aside, because this is what everybody is dealing with. Not to mention, the international and national implications of this as people travel and we live in a global world, right? So it's really important to understand that it's not just like, oh, somebody made a silly comment at a party about, like, I'm not vaccinating my kid. It's important that you stop that information and talk about what we know in science.
Yeah, I just want to ask, do these vaccinations wear off, or are we?
No, double dose vaccinations last for your life. And we can talk, I mean, that's another conversation, but I'm talking about from at a community level, from a vaccination standpoint, from a coverage percent. And there are always people in our community that can't be vaccinated, that are immunocompromised, that can't be safely vaccinated. And that's why everybody who can needs to be, so that we achieve herd immunity. Okay, so again, I don't want to get it, I'm showing you that as an example of what happens when stories and not facts get disseminated. This climate change is another big one. I'm not going to debate climate change here. I am not a climate scientist expert, but I think what we have going on, there's a lot we don't know. I work every day with climate scientists who will readily admit that there are many things we can not say definitively about climate change. But there are some things we can say, and one of them is that the global temperature is definitely increasing, and we are experiencing the impact of that. And what happens when we are countering misinformation is that instead of focusing on these kinds of things, and you'll never be able to read this, so I'm sorry, but what this basically is saying to is that what we need to be investigating is, as temperatures rise and they interact with things like geography and erosion and socioeconomic factors and other kinds of things, we need to understand and study what happens to our air, what happens to our water, what happens to our food supply and safety. We don't know all of these things. So I don't disagree with people who say we don't have all the answers, but we know things are changing, and to deny that is to deny basic fundamental science that then allows us to investigate systematically what else is happening. Right? So I want you to think about these things as there are always points of debate. Science is never perfect. I'm an epidemiologist. I don't look at causality. We look at correlation. We look and we study things over time, and then we determine what kinds of things likely increase our risk. So there are a lot of things we don't know definitively, but when we start questioning the things that are at the fundamental basis of the things we do know, we then divert our attention and our resources away from things that we could be doing. So I want to kind of switch gears and talk a little bit, and then we can talk openly about other kinds of things. But what I wanted to share with you a little bit is, okay, so what else? What else can we think about? What do we want to focus on? I want to share a couple of things with you. There are a lot of trends happening in the world, right? And we talk about, and there are many more that I'm going to highlight today. We have an aging population. What does that mean for healthcare systems and how we expend healthcare dollars, and how do we look at that both nationally and globally? There are lots of different health expenditure, the trends, and where that's going. But what I wanted to just highlight is to show you two things. One is urbanization. So let me just bear with me. I think you'll be able to focus on this. So right in 1960, we had about more than 50% of the population living in urban areas. I want you to see how this changes in the next, how it's changed. And we'll go all the way up 2020, so right about where we are now. 2030, 2040, and 2050. So what this says is that by 2050, and you saw where we were in 2020, which is basically now, is that we are in an increasingly urbanized world. So in some ways that's not surprising, but what I want you to think about is, what does that mean in terms of our health, in terms of these trends, in terms of things like outbreaks of infectious disease when we live in quarters, right? In our ability to grow food and have access to green space globally. So these trends, while they are interesting and maybe not surprising in and of themselves, have real implications for our health. And we have to rethink, I think, in many ways, the ways that we tackle our own health and we tackle and participate in conversations about health at a policy level and at a community level. The other trend that's kind of happening along the line, so this is countries with McDonald's in 1965. So you can see we were kind of alone, and I remember being a young kid in the first McDonald's, but this is what's happened over time as well. So 1980, 1995, 2010, and 2016. So, and again, I'm not showing you this slide necessarily to vilify McDonald's per se, right? But I think what it shows you is that what we have is a global trend where many, many more people who have limited means now have access to very nutrition-poor, caloric-dense food. And what does that mean for our nutrition, for our food systems, and how we transport food around the world and its carbon output? What does it mean for individuals' health in those communities, their ability to access? What cultural changes happen in communities who used to rely on fresh fruits and vegetables, but now believe that becoming more culturated, sophisticated, urbanized means participating in having access to these kinds of foods? And it really means that what happens in many countries, and for those of you who've traveled in South America, in Asia, and other countries, is that the choice to feed your family with very cheap foods becomes this, because it's available and it's cheap and it doesn't require you to leave the urban setting that you're in. So I'm going to kind of talk a little bit about this, which is something that came out in January 2019. We've been talking a lot about it at the School of Public Health. I am not a food climate change expert, but I think what the conversation has shifted is that food is actually becoming pretty central to health, right, and to our environment. And this report is really interesting. So syndemic is a word that I was not as familiar with. We're very familiar with epidemic, right? But syndemic is when multiple epidemics kind of converge and they actually have an impact on one another. Okay, so why is this important? Because we've often, particularly in health, been looking at these three issues as completely siloed, separate issues that need different sets of policies, different sets of education, and different sets of action items. And the fact is, they don't, because if we take one example, which is meat consumption, for example, red meat consumption, right, and we reduce it, we have an impact on obesity. Right? So red meat consumption has a linear impact with chronic disease, and it has a huge carbon footprint. Right? So the interesting thing about this report, and I think the interesting thing about how we talk about health and science in the future, is to really think about how do these three things come together, and how do we, instead of having, in my school, we have a Department of Environmental Health Science and a bunch of people studying climate over here. We have a bunch of people studying cancer, cardiovascular disease at the hospital and in our school. And then we have a bunch of people who are studying refugee health, forced migration, and undernutrition. And they're not all working together in ways that can really make an impact, right? And it also, I think, even at an individual level, means that each of us should be thinking about how what we do impacts all of these things, right? So a little bit, I'll just talk a little bit. I think one of the most interesting things that's come out, and this is a very sciencey slide, because I don't even know that obesogenic is a word that most people know. So let's ignore that for a minute, right? But I think what's really interesting in this report is, and if you remember when I talked about behavior change around smoking and the seatbelt, right? When we were successful, it wasn't because we convinced people to stop smoking or put on their seatbelt. It was when we made it illegal or we taxed it to do so, right? So one of the things we've been focusing on so much around obesity is individual behavior change. If you're overweight, it must be your fault. You have to go on a diet. It's the doctor's fault for not talking to you about your diet and nutrition. And we've been focusing very much on an individual level. And I think what's really interesting about this report is that it really focuses on the fact that we have obesity is those maps I just showed you. Increasing urbanization, less access to fresh fruits and vegetables, less access to affordable fresh fruits and vegetables because people are moving into the cities and they have closer proximity and easier access to McDonald's or other kinds of poor nutrition-based foods, right? That means it's not individuals' fault. It means the food system is changing to a point where obesity is becoming accessible and available to everyone. And we've looked at it from a public health, and you could do a whole nother presentation on, here, as you saw, we've gotten rid of infectious disease, and the rise of diseases has been around non-communicable diseases, heart disease, cancer, diabetes. That epidemiologic transition is happening everywhere in the world now, right? And then you have poor countries that have a double burden of trying to manage infectious disease, malaria, Zika, and a transition because of this urbanization and proliferation of fast food, a transition of managing with very limited resources populations that now both have diabetes, high blood pressure, and people who are suffering from infectious disease. So again, I think this is an important rethinking paradigm shift, if you will, that we have to think about problems associated with overweight as food system problems and not individual health problems. And I think the other piece that this quote I think comes from this report is the human cost of our poor food systems is both in overnutrition and in undernutrition, right? So when our food systems don't work, people don't have access to fresh, healthy foods, and they have easy access to poor, nutritious foods. So the other thing I wanted to think about, and again, I mentioned this before, is that this globalization of food systems, incredibly powerful. Think about the tobacco industry. Think about what they pushed back and how they impacted our ability to improve health. And this is what's happening with food systems now, right? There is incredible investment of resources to build and transport food across the world, across our country. And this is something we have to think about. It's not just thinking about, again, at an individual level, but also at a systems level, and what kind of work do we need to do to impact that. And again, I think this says it, we can't be naive to think that people don't have vested interests in the food systems the way they are. And again, I'm not necessarily doing this to bash the food industry and to say that they can't be our partners. And arguably, we've had many conversations about how do we partner with the private sector to be more effective, to make more nutritious foods available. So it's not an either or, but I think we all have to be cognizant of the influence and how, when we see confusing news reports and when we look at studies, to think about who's funding this study, where did it come from, should I be taking it at face value, or should I be exploring and really thinking, looking more for factual information or science-based information. So the one that I was fortunate enough to be at the launch of this Lancet report in New York, and the study, the founder of the authors of the study or the report, kind of, they stopped short of in the report. Actually, many people challenged them to say we should get rid of red meat. They should have called for an outright vegetarian-based diet, vegan-based diet, because of its impact on climate and health, and because of its impact on obesity and non-communicable diseases. And they explained the politics of that. Also the transition that the developed world goes through when they have more access to resources, the cultural need for meat in many, many countries, and to the realistic version of saying that the world is not going to go vegan. Right, so what do we do? So this was the quote that he left with, and I thought, is that we should slant plant, right? Maybe we don't all have to become vegetarians but we should think about, when we rethink what's going to make the most sense for us, both, again, not just from a food perspective or an obesity perspective, but from a climate and health perspective as well, that we slant plant. So it was catchy, it stayed with me, and it's something I try and talk to some of my eat-meeting children about, but not to less success. So, one of the things that Jeannie and I talk a lot about is, so, it's easy to kind of sit back and go, oh my God, it's like we're doomed. So hopefully that's not the message. And, I think this is, to me, something I try and think about a lot is, we all need to be critical and ask questions. And make informed decisions both for ourselves, our families, and for our communities. We need to think about science and not stories. So, it's very easy. Many people who want to change behavior or change your consumer habits are very good at using stories, particularly in the age of social media now, of, showing stories of something that's happened to somebody, something terrible that's happened as a result of one. And terrible things happen, but that's not evidence towards changing direction in health, in policy, and in our own informed decision making. So while you might get sucked into stories, and we all turn on our phones in the morning and see a headline and we click and go down some rabbit hole, try and remember that it's a story, that it's not necessarily science. And I think that's something to keep in our minds. We're all really smart and intelligent and participate in so many different sectors of our lives. Disrupt the conversation when it's going in the wrong direction. I think we all have an obligation to do that. We're informed, we're in health, we're concerned, you're concerned about health and well-being. And when you hear people making comments or talking and citing resources or sending you a link to something that is not right, we have to disrupt the conversation. And be bold. I think we all have to advocate. If we really look at, it's not enough to focus on ourselves. As I mentioned, there are policy, when we've been really successful in health, it's both making differences at an individual level, but at a community level. And, again, I don't want to be political here, but most of the action in the world is happening at the state level, at the city level, and at the community level, right? And we're not able to do things nationally in many cases. So instead of throwing up our arms and saying we can't do things at a national level, what can we do in our own communities that can serve as models for other communities? We talk a lot about this in New York City. New York City is progressive, and often when they make a change at a city level, at a municipal level, other cities say, well, that can be done in New York City, then we can do that here. So, there are model programs, and we can each need to be doing that. And, of course, and being critical and asking, it's informing your own decision making for yourself and your families. I think that's all I have. I try not to be like cliche with quotes, but I think when we talk about public health, I think we often feel like, well, if I make a change to eliminating plastic from my life, like, big deal. The whole world is, we have lots of problems to worry about. But, I think that if you ever feel like you're just one, if all of us are doing that, we really have the ability to change. And at the end of the day, that's really important right now in the world. There's no magic bullet, there's no magic solution to sort of say we're going to pass one law or wait for one thing to happen that's going to fix this. It's going to require all of us, to rethink. And I think the reason I shared the Lancet report is what I've seen the ripple effect happening both at really high scientific levels and at really individual levels is just this thinking of, the way we've been thinking about food and obesity and climate change is just not the right way, and we have to shake it up. And we have to rethink and ask questions in different ways and engage in different ways. And the only last thing I'll do is I'll make a plug in that, I think when I went and studied I did my MPH couple years ago. We didn't really talk about food as a public health issue. I think we each were required to take a course in nutrition, but it was very minimal. And we're really building, putting food at the center of all of our studies as a way to bring people together so that we can think about overnutrition and undernutrition and what's happening in forced migration around the world that's impacting people's ability. Food insecurity is often a reason why people move, and move in massive ways that are really impacting the rest of the world. So it's trying to think about these things together in an exciting way, and sponsoring our students who really want to focus on food policy so that their next generation of scientists are actually engaged and understand these issues and can advocate really fully. And I'm going to stop there. I'm happy to answer questions. I don't know everything, but I'm happy to take a shot at it. Yeah.
I would love to know whether in your work you're looking at Roundup and glyphosate and what that's doing to our food chain. Because we're talking about fast food is one thing, but also just our healthy, what we think a non-organic piece of broccoli is giving us, whether you're looking at that at all.
Yes, tremendously. I am not, but yes, we have a whole group of scientists who actually look at pesticides, environmental pollutants, particularly on early child development. both in utero and in early child development and its neuroscience, neurological impacts. And many of our scientists actually use their science and advocate on the Hill and at legislatures to actually push back on some of this and are engaged in a lot of these efforts. Yes, it's incredible. So, by no means that what I present today is fully the whole realm of things, environmental toxins and exposures. And there's been a rollback at the EPA that it's alarming on some things that we absolutely knew were cause neurological consequences in children that are, we're losing some of that ground that was gained. It's another example of things that have very good scientific evidence being rolled back. And this particular situation is really an amazing, great example of science that's funded by industry versus science that's not, and the tension between those two, and how that impacts the ability to make policy change when you have large corporations who have a lot of influence.
So what would you say, like, for us as, just a mom here, what would, in your opinion, best advocate for policy change?
It's a great question. I mean, in that particular case, I think it's going to play out at a very high level nationally because it's there right now. But I think it is questioning around local policies and schools. What food is being served, where is it sourced from, where is it coming from, understanding that, not taking for granted that those things are already being examined. I think one of the things that we often think is like, oh, people already know about that and they've looked for that, and that's not always the case. So, I think it is really understanding what's happening in your community, where the food's coming from that goes into our schools, and thinking about what other kinds of issues are here that impact us locally. I also think it is not unimportant to, when you see these studies and you recognize that people that you vote for are on the wrong side or not paying attention, to reach out to them. I mean, there is, we take our students every year to Capitol Hill, and the people in those offices count. Right? So if you call and you call and you call, they track that 25 of my constituents called today and are concerned about this particular case. So it does make people pay attention and know that the people who are voting for them actually have these concerns, so that they're hearing the other side, right? They get donations and support on one side, and I think it's important for us to be able to voice that these issues matter to us as well. And as you go forward, know where people that you vote for stand on these issues. It's really important to know, right? Yeah.
In regards to Monsanto, I don't know if you read it in the paper, but a San Francisco judge awarded $18 million to a person that went to court against Monsanto on the Roundup issue.
There's actually two now.
Or
they
two
just
now.
awarded another one.
So I think California is often the front runner in, slamming these companies and putting in brakes and not doing what the government exactly prescribes in EPA standards and whatever else.
Absolutely, and I think California, New York are often out in front on these issues and serve as models for what happens. I mean, the soda tax in Berkeley, which people will, I have colleagues that will poo-poo and say, well, it's Berkeley, so of course. But you know what? The data is being tracked. I can tell you from people who do science and health policy, the data is being tracked very carefully, and everybody's looking to see, because of that change, what's happening. And if those data are strong and the science shows that things are happening, people all over the world are going to use that to model. So it absolutely, you guys have the really important, so when things happen at a community level, I think the most important thing is to make sure that people set these things up well and that they're measuring and monitoring them and collecting the data so that people can share that and they can serve as a model. Yeah.
To what you do and where you teach, what I'm curious is, I have a daughter who was in China, and her big takeaway was we're chasing disease and illness in this country versus they're hitting on the forefront holistically with food, meditation, yoga. Are you, not you, your school and educators, training our upcoming doctors, professionals, health service people to be more open and broad in their way so that we can become people who are addressing disease before we have to treat
it. Right. We may be a system that focuses on prevention instead of treatment.
Right.
There are lots of communities around the world that do that better than us.
Right.
So, I think a couple of things to that. I can't say that we're changing the healthcare system here overnight. What I think is happening and I see happening is we, particularly in public health, recognize that there are other places in the world that know and do these things better than us, and we can learn from them. I think there was a long time where in the United States we always felt like we were the leaders, we do things better. I think that's changing. And I think very often we look at research that's being done in other parts of the world and look at different interventions that are being tried effectively and taking those lessons learned and taking it. We do a lot of visiting scholar programs, we do a lot of exchange programs where we bring scientists over who are doing really interesting work in different areas so that we can learn from them as well. Do I think it's happening as much as it should be? No, probably not. But I do think there's an openness, and I will say that we, particularly at our school, but I think in many schools, are training a really diverse group of young people who come from all over the world and grew up with exposure to these differences in ideas about religion, about culture, and its influence on health, and different kinds of practices, and they want to study this and learn more about it, and so they're pushing us to do more. So, yeah, it's starting. I think we can do more. Yeah.
I should say, back to the policy conversation, are there specific policies today that are being pursued that we should support? I mean, are there specific efforts that we can start to get behind? I mean, there's these individual cases.
Yeah, well, I think it's a harder question to, I think some of it depends on your own values and beliefs, but I think the environmental pieces and what we're learning about the contaminants and their impact, some of that we've known for years. I mean, this is not new science, and whether it's been suppressed or ignored or bypassed or things have been rolling back, I mean, I think those things are really important to continually push for. And I think the environment is one big area that I think we have the ability now in ways that we never had before to really study what happens at a cellular level, at a genetic level from these toxins. And so being able to continually advocate for support to continually do that work is really important. We could talk about gun violence and the policies around there. We could talk about prevention and ensuring that our healthcare coverage and access to healthcare ensures that people have access to services that focus on prevention and not just treatment. So I do think there's a lot to do on all fronts. I think all of us can only be passionate about so many things at the same time. So I think a lot of it is trying to figure out, what is it that you care deeply about that matters to you, to your family, to your community, and really stepping up and engaging on those topics.
You brought up McDonald's. Where is the hope for change concerning that? The smallest little towns throughout the world, pedestrian zones, they now have McDonald's, as you showed. Does childhood obesity have to get so bad, lack of vegetables, fruits, before we even see change? I mean, a lot worse. How do we change that? It's not like Roundup.
Well, it is in some ways because, the proliferation, there's a complicated question and there's a lot of ways to answer it. So I'll take a stab at a few things because I don't want us to feel hopeless because I think it's important that we don't. I think ensuring, like in this country, that people can utilize public assistance, for example, to purchase fresh fruits and vegetables and pushing for change at that level is really important. So that it's not, right now, even if there's a McDonald's on your corner, if that's the only source of affordable food that's convenient and fast, then that's what's going to be coming into your home. But if we can work to affect policy to make it so that people who have limited means can actually afford fresh fruits and vegetables, that we support city gardens and organic gardens in communities. They sound small when you see, what's happening at the proliferation of fast food, but they are really important because it does happen community by community, right? It is about people being able to have access to affordable, healthy foods. And we have to be able to, some of that's the policy of this country, the Farm Bill, corn subsidies. We could go on and on, around what we've built and designed in this country around food. I think there are things we can do. I think some of it really starts at making sure that we have both policies and community level support for people to have access to healthier foods. Yes, sir.
I just wanted to follow up on that. There's two other areas of influence. One is just there is a real social influence. You look at what's happening with Coca-Cola and Pepsi, and they are responding, not because they want to, but because they are understanding that if they don't change what they're putting out there, they will die. And you're seeing that every day at Coca-Cola, Pepsi, et cetera. Then, getting to the other part, it still is a money game in the sense that public companies like McDonald's or Coca-Cola, their stocks are owned by very, very large institutions. And the very large institutions are the big public pension funds, the state of California pension fund, the state of Texas pension fund, Fidelity Investments, et cetera. And increasingly, all of these public pension funds and investment firms are actually taking an interest in all of this stuff and literally saying, you know what, we won't buy companies that are coal companies. That's the first thing. We won't buy cigarette companies. We won't buy coal companies. And the question is, when can you get to the point where you have enough influence at the investment portfolio manager of CalPERS to say, we won't buy McDonald's or Burger King or Coke or Pepsi. And once they won't do that, then the companies will die.
And they're the food companies are afraid of that now. They see that they could be the next group. They've come to us. Pepsi has come to us and asked to partner to do scientific research. Now, there's lots of conversations around that and ethical considerations, but I think they absolutely see that this is the social. So I think that the other, to add to that is, we can't underestimate the power of the consumer behavior and the social constructs. It used to be that everybody stood on a corner and smoked cigarettes, and that's completely socially unacceptable to do now, right? So what's the next, right? How do we keep going there? Yeah.
I live in a community where we have a lot of people in the hundreds. Not a lot. We have some in the hundreds, some in the late 90s, a lot in the late 80s. And they say, well, I've been eating meat all my life. You can't argue with them. They are here. They are here, and they are evidence. However, what was their childhood like?
Yeah.
What kind of food
level
do they eat?
That's a great point.
My mother, I came home, I didn't have milk and cookies. I had green peas that I would peel delightfully, and I had cut up cucumbers and celery, and
Right, it was a different world, right.
So I don't know, there's a lot to be said on both sides. And it's
But you're doing something important that's important to you that is helping.
I hope.
Yeah.
So in terms of where our money goes, I did notice that Impossible Foods is now being served at Burger King. And I'm not, it's one processed food supplanting another one perhaps, but we should pay attention to the younger companies that are trying to change the course of food capitalism. And I'm not sure how we can influence the big investors as individual shareholders, but people working at the union level can tell their union leaders that we do not support where our union's funds are being invested, and so we should look for signs throughout the capitalist structure that we have right now and crowdsource different ways of economically influencing the outcome.
Right, and there's certain, I'll tell you just a quick thing. The New York City schools actually just approved Meatless Mondays for the school system. And why? It was really because they want to make a difference in the carbon footprint, and they want to help improve health. So it's a small thing, but that could happen in school systems all around the country in a way, and that changes what's being bought, what's being sold, what our children are being exposed to. And again, it's a step.
So the food system can be disrupted from the
bottom, absolutely.
as well as from the top.
Absolutely, yes.
It's such a complex.
Yes.
Because the Impossible Burger, only because my sister, I haven't read the article yet, but Horticulture Magazine it's so heavily GMO'd.
It's not a great product.
No, it's really processed.
It's not a-
It's
it's
highly
Highly
processed.
processed and highly GMO'd and it's Roundup ready and
It's not a good.
it's just so complex and everything's so interweaved and there's good ways to raise beef that are actually good for the soil and good for the land. Anyway, I mean, and it's what you're speaking
Right,
of.
so it's just,
so
there's
complex and so interesting.
it is complex, and I think we have to sometimes just focus on some of the fundamental things that we know and not get lost, right? So we know that eating less meat is better. It doesn't mean we'd have to eat no meat. We know that eating, grass-fed and so on and so on. So we know some of that, and we can, we have to make our own decisions. I think it's just thinking about that, for ourselves, and then more broadly, how can we extend that to ways, and that we don't get toe bogged down by the complexity, because sometimes you feel like you can't get out of bed. Yeah.
I just want to put a plug in here really quick for this idea that I had with the glyphosate, just in terms of Roundup usage. I told my gardener he didn't know about these other groundskeepers getting cancer from using Roundup. So I told him, and his English is really limited, so I actually I wrote up something and used Google Translate, put it in Spanish, and gave it to him. And he came back to me a week later, and he was so happy, and he put it up at his church, and he told all his friends, and he's like, now when I'm at Home Depot and I see people with it in their cart, I tell them they're gonna get cancer from using that. And that I thought was powerful because he is spreading it to protect himself and his industry level.
Right. I mean, you live in a community that is full of migrant workers and
Yes.
the growers, and there's ways to help educate and move. That's an amazing thing you did.
So I hope that
Congratulations.
everybody could do that to them.
Yeah.
Send that to us?
Yeah. 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 Yeah.
I'm wondering if there's a place where epidemiology, public health, and futurism kind of come together to identify what you're most concerned about, trends taking us into the future, public health trends.
Yeah, we talk about that a lot.
Development, yeah.
We do. We talk about that a lot. I mean, you look at the landscape, and as a school, individually, where are we going to invest our resources? What new programs do we need to build to educate our students? What science do we need? What capacities do we need to build? I mean, it's a conversation we have a lot. This climate piece is bubbling up repeatedly. I think there's a lot. I mean, I don't want to. Again, I didn't speak too much about it. There is a lot of scientific discovery being happened at the sort of genomic level and the exposome level, in terms of how do we have much more sophisticated tools now to study what's happening at a genetic and a cellular level, and we have the ability to measure. My colleague who sits next door to me is a metabolomics researcher, and I still don't fully understand what he does, even though he's explains it to me many, many times. But what's incredible is the laboratory infrastructure that we have to build so that he can measure, when I showed you that circle, like how at the same time and model how environmental influences, infectious agents, social factors all influence what happens at an individual level and at a cellular level. And so there's really exciting science that we have to continually invest in. But I also think that there's an incredible amount of work that needs to be done in terms of advocacy and policy. But I think this intersection of what I was at a meeting 2 weeks ago for the American Association of Schools and Programs in Public Health, so all of us in the room, and this Lancet report was something that was talked about a great bit in terms of how do we build programs around. This is not what we've traditionally trained our students to think about in epidemiology and in public health. We've really focused on cancer and heart disease as kind of individual entities. So how do we bring these things together in powerful ways and build the right tools to measure for the future?
So you mentioned you have these like silos in your school. Are you guys all conversing now, or is that kind of the future?
So the buzzword of our world is interdisciplinary science. That's what we talk about a lot. And we're, I think, funding people to work together and incentivizing people to work together across disciplines, because these kinds of complex problems like food, obesity, gun violence, all of these things that we're talking about aren't solved by one particular perspective, one person at a time, right? You really do need the benefit of multiple scientific disciplines and expertise and methods to come together. And you also we have a Department of Health Policy and Management. I mean, you need those people to be trained to take the science and advocate for policy effectively. So there's a lot that we do, and we are really trying to break down the silos between and among sciences and really and that's happening I was here here at UC Irvine earlier in the week at a program in public health, and they're building a College of Health Sciences as a way to bring everybody together under one roof to be much more interdisciplinary and address things.
I just have a comment, the ability of scientists now to look at things at genetic levels and look at micronutrients and all this business, disseminating their knowledge has not done a service to the research, and what's being printed in the media is causing this increase in crazy use of supplements, and you read articles that don't really truly say what the research said. And I think that's a part of this misinformation, and how do people get the real information instead of just taking a piece of it?
Yeah, I mean, I agree with you. I would frame it slightly different in that I don't actually think it's the scientists that are disseminating it incorrectly or poorly. I actually think it's when consumerism and food, and not food, but companies and others get involved in disseminating. And you also look at, we have this conversation a lot. You look at health reporters in newspapers. It used to be like there was a science writer and that was their whole beat, and they really did, that's all they did. I mean, now people are writing about health that have no background, no knowledge, and they're trying to translate very complicated research into something that's usable, and it gets lost in translation. I do an exercise with my students where I often have them pick the original research article that was written on something, and then the corresponding headline on a blog or a newspaper, and the disconnect is huge. It's shocking what gets translated and what doesn't get translated. The easy solution, I don't know what that is, because sometimes the information is complex and we need to get things out in a better way. And I think I personally, I trained in journalism before I trained in science, and I think scientists, they pretty much suck at communicating. I mean, for lack of a better word, they're not good at it. Many of them are not comfortable doing it, right? And so, so we spent a lot of time trying to train our scientists to actually not be afraid to speak to reporters. You need to be able to translate your science, or what's the point? I mean, not everybody's going to read your Nature article. It's great for you and you get promoted, but so it's a great point. Thank you.
Well, I think a follow-on to that is just that the journalists are trying to sell their newspapers or their magazines, so the headline is always often inaccurate, and then nobody reads beyond the headline or beyond the first paragraph, and it is incredibly frustrating.
And it's really hard. I mean, we live in such an information-rich world, right? So there's so many people competing for your eyeball now that it's even worse than,
So where would you say we should take our eyeballs? Like, you guys are doctors, Jeannie, you know the sources, but I don't really know where to go. That I really want to know. Like, my kid comes home and says, "Oh, marijuana's not a big deal, Mom. Everybody's doing it," and then I read stuff and
that's next week's topic.
Yeah, it's a totally separate thing, but that's the crux of how do we get to the fact. We're all smart people.
Yeah, I mean, and Jeannie, you could probably respond to this as well. I mean, I think some of it is really looking at the source that you're reading, and when something says .gov, it at least, or it's a science-based organization versus an advocacy organization. That doesn't mean you shouldn't read what other people are saying, but just know that they're coming with an agenda. Right? Like, it's interesting to know sometimes what someone is saying from a food blog perspective, but don't take that as its gospel. Check it, verify it, go to an unbiased or at least a scientific source, a university source. I can't tell you that there's a pure source anywhere anymore, but I think our best bet is to try and look for confirmation among and between verifiable sources, the government, the science, Stanford's website, and check and see where people are getting funding from. The one thing that has changed a lot, it's not perfect yet, but it's much, much better, is that people have to be transparent about who's funding their research. And so it's published, and it will say this was funded by a grant from the National Institutes of Health. Well, that's a federal grant. It'll say this was funded in collaboration with this university or not this university, or has private funds. Again, doesn't necessarily mean it's wrong, but you know what you're reading.
Thank you.
Right, yeah.
And a little bit on that same subject, my kids are at 2 different schools, and they were just saying like 2 weeks ago, "Oh, Mom, vaping is not, it's not addictive. It's so much healthier than cigarettes." And I'm like, what? Where are you guys getting this information? And your like little measles slide and your tobacco slide, I'm just wondering in 2000.
Yeah, so I almost put that in. So the vaping is like this in teenagers, like this, and it's a big, scary problem. We're doing, there are a lot of people trying to look at that, but you know, we don't know, there's a lot we don't know. But I think not, you know, there are many countries that act before they know fully, right? So we have a long history with tobacco. We know it's bad, we know it's addictive. Just because the format has changed doesn't mean we should sit back and wait and say, let's wait until we have many cases. You know, we do know the addictive properties of tobacco. We know there is addiction happening with these e-cigarettes. The use is incredibly alarming. It is the thing we're the most scared about among young people. And there's a lot, we even have people who are researching, you know, there's a lot of that, there's carcinogenic pieces that are thrown off just from the heating, the coil, that the companies are claiming is not happening, but we've actually been able to break it down and look at the particles and show that it is. So, you know, there's a lot of science that needs to, you know, these are the things that happen in our world, that things change quickly. The science isn't always where it needs to be in order to make 100% certain decisions. So, you know, I always tell we talk a lot about this in my students, is you have to make decisions sometimes in uncertain times. And so we have enough history with tobacco, I think, to make some informed decisions and set policy rules. You see it happening, I mean, but it's not fast enough, and it's scary. It's really scary. And the misinformation among our kids is yeah. Yes. Thank you.
Thank you.